Well, good afternoon, everyone. Thank you guys for logging in to view our next installment of the Livestock Guardian Dog webinar series here at the AgriLife Center. I would like to thank the Sheep and Goat Predator Management Board for making this program available for us and providing the funding for my position. Just a few housekeeping things real quick. If you have questions, please post those in the chat box, and we will try to get those questions all answered at the end of the presentation today. If you have to log off and you miss part of the presentation, it will be posted to our YouTube channel, and the address is there on the slide. Also, don't forget we have our AgriLife Livestock Guardian Dog Facebook page and also an Instagram account now too. And then there's the monthly blog that we post on our website, and you can sign up for that there at the bottom of that page also. So I would like to thank our webinar sponsors today. It's Lone Star Tracking and the Historic Pfeiffer Ranch. Thank you guys very much for sponsoring this webinar again. We sure appreciate your support. So with us today, we have Dr. Chris Womack. He's a veterinarian here at Los Caballos Veterinary Clinic. He got his degree from Texas A&M 1987 and his doctorate in 92. He's worked at Los Caballos Vet Clinic since 1992, became a partner in 2000, and he's an owner in 2014. So with that, I'll turn the presentation over to Dr. Womack, and thank you very much for coming out today, sir, to do this for us.
You bet. We're going to switch. Oh, gosh, it's an uncomfortable chair, man. Thanks. All right, so topic of Ehrlichia in dogs. So how does this? Just roll down. Okay. Yeah. All right. We deal with a fair amount of Ehrlichia in this part of the world, and we do a lot of testing of dogs for rickettsial disease, and our 4DX is the in-house test that we use, and it tests for Ehrlichia canis, Lyme's, anaplasmosis, and heartworms all in one test. And by far and large, the Ehrlichia canis is the most common rickettsial in our part of the world. I can count on one hand how many times I've seen a positive Lyme's dog, and all of them have come from the East Coast. I do every now and again see positive anaplasm dogs out here. The differentiation is a little bit academic because you treat them the same way. But I would say that Ehrlichia or Ehrlichiosis is a very common problem for us here in Edwards Plateau, Hill Country area, from San Angelo to the border. It's very prevalent. I don't have any idea what the prevalence is, but it's pretty darn common. Typically, the Ehrlichia is caused by and transmitted by the brown dog tick. I have seen some stuff that says other ticks are capable of transmitting the disease. The organism's not a bacteria, it's not a virus, it's not a protozoa, it's a rickettsia. And rickettsial organisms they're kind of a strange organism. They're kind of like a bacteria, they're kind of like a protozoa. The nice thing about them is they typically respond to antibiotics like the tetracycline class of antibiotics. I guess I should go by yep. Okay, so transmission, the dog's got to be bitten by an infected tick. In our part of the world and really throughout the United States, the brown dog tick is usually implicated as being the vector. But there is some information out there that says other species of ticks are capable of transmitting it. I've never heard anything about fleas transmitting it. It's got to be a tick. I guess if you were vaccinating or giving a bunch of dogs a shot and you use the same needle, could it possibly transmit? Could we transmit it as a vector ourselves with a needle? I guess that's possible. I wouldn't recommend injecting more than one dog with one needle. So again, I could just see where that might be an issue. Clinical signs of Ehrlichia, sometimes they're very subtle, and sometimes it's difficult to diagnose. Sometimes in the early stages, we're just seeing a dog that's a little off. They'll run a fever. They'll just kind of feel bad, be sluggish. As it progresses and as the disease progresses from an acute to clinical stage, the clinical signs tend to increase. But some of them can still be pretty obscure. But they're fever, feeling bad. A lot of them are stiff jointed. A lot of them have nosebleeds, or they'll have blood in their urine, or if you look at the skin of their ears or their abdomen or their gums, they'll have little tiny hemorrhages under the skin or under the gums. And that's because the organism affects their ability to form clots. So a lot of them, when you see swelling in the joints, a lot of it is because they're bleeding. Just normal trauma, running around, jumping, just walking around. Some of them can have bleeding into their joints, and the joints will be really swollen and really painful. I've even seen it in the jaw, where the dogs won't eat because they've had bleeding into their temporal mandibular joint. And a lot of them will come in and they'll refuse to eat. And when you try to open their mouth, it hurts. So that goes back to the bleeding tendencies that take place. Some of the lymph nodes, again, will be swollen because they're either reactive, or they can actually have some hemorrhaging in the lymph nodes themselves. Over the years, Ehrlichia is been, especially the early stages, has been difficult to diagnose because the dogs just feel bad. I would tell you that the diagnosis, obviously the blood test, a quick test that we have in the office is looking for the antibody. There is confirmatory tests that have to go to reference labs that are PCR, or polymerase chain tests, that are looking for the antigen itself. They're looking for the DNA of the organism itself. Those take time. The quick test in the office is real valuable. And in some of these dogs, if it's real acute, it'll be a false negative because they hadn't had time to form antibodies. But sometimes we diagnose it just based on the clinical signs, presence of ticks, and where they came from. If they came from Menard County and they got a bunch of ticks and they're feeling bad and running a fever, 9 times out of 10, that's going to be Ehrlichia. So we can confirm it once it's been in place and the body's had time to form antibodies. But diagnosis is sometimes seat of the pants. Treatment, like I said before, the antibiotics, the tetracycline class of antibiotics, specifically doxycycline's a treatment of choice, but it requires a pretty extended treatment regimen. 28 days is what the majority of the literature suggests, and I would tend to agree with that. Some of the dogs are pretty bad. Some of them are anemic to the point that they have to have blood transfusions. Some of them are, debilitated enough they need anti-inflammatories. I typically use steroids for the inflammation, especially the joints, lymph nodes. They're feeling pretty bad. I use B vitamins to encourage the regeneration of red blood cells. Obviously, removing the ticks is a big part of treatment. Dip sprays, picking the ticks off. If you wear gloves, I think that's fine. Ehrlichia is not easily transmitted to people, but in rare instances, it can be transmitted from the tick to a person if that person is immunocompromised. Specifically, I had a professor that died from ehrlichiosis because she'd been in motorcycle wreck, had a splenectomy, and was bitten by a tick that was infected with Ehrlichia. Sick and dead before anybody realized what was happening. So it's rare. It's rare for it to be for Ehrlichia canis to be a problem in people, but bear in mind people that have immunocompromised systems, it could be an issue. So I think getting to them early, getting the long-term antibiotic treatment is helpful in most instances. I think in my hands, if the dogs are chronic, if it's been going on a long time, I think we can beat it back. We can beat the thing into submission, but I don't think it'll ever clear. I think some of these dogs, and this is my opinion, I don't have scientific verification of this, but I see dogs that recur with Ehrlichia, and I think it's because it's become chronic. I think that organism hides in places where we can't get to it, like the bone marrow or the spleen, and stressful situations, heat stress, cold stress, parturition stress. I think we can see recurrence of the disease in the same individual even after treatment. And I have treated dogs over the years multiple times. You also have to take into account the fact that they live in the environment where it came from in the first place. And I think sometimes you just get an overwhelming load of organism if you're not careful in keeping the ticks off the dogs. So little soapbox speech, but that's part of it. Prevention, like we talked about, I guess if you didn't have dogs in an endemic area, that'd be the biggest way to prevent it. But we've got dogs in the Edwards Plateau and the Hill Country, and we need our dogs out in the country where they're doing their job. So their exposure to ticks is pretty high. Several different methods of trying to control the ticks, and I don't know that there's one size fits all for every producer and every dog in every situation. The orals, Frontline, Simparica, Bravecto, they've got their pluses and minuses. I've got the most experience with NexGard, use it a lot. You're going to have a dog that'll take an oral treat, and some of these guard dogs won't. You've got to give the NexGard every month. And again, that's scheduling, that's some husbandry issues that you have to be able to overcome. Some of the dogs that are pretty close and pretty tight, that's not a big deal. And it's very effective. Simparica, I have no experience with. I have not used that product. The Bravecto, it's given every 3 months. It's got pretty good effectiveness for the brown dog tick for the full 90 days. But some of the other species, I believe it's a Lone Star tick, it's only got a 45, 60-day effectiveness. But it has its place. Again, Bravecto comes in a topical or an oral. It comes in a pill or a topical. And it's got some merit. I've got a little bit of experience. Y'all used some of that a little bit, didn't you? Yeah. And again, it's not a one size fits all, but it does have its place. The topicals, again, Bravecto does have a topical. Frontline, Advantix. The only thing I see with the topicals is you're going to have to get it on their skin. They need to not really get in the water for 48 hours, which a lot of these dogs get in the water troughs on a pretty regular basis in the summertime. That's a hard pill to swallow. Some people still use dips. Dips are effective. The problem with most of the dips is they don't last about a week. So you can mix up the permethrin dips and get ticks off of a dog in a hurry, but there's no long-term effectiveness for those things. There's been rumors of a vaccine I've been in practice since 1992, and as long as I've been in practice, there's been rumors of a vaccine to be developed for Ehrlichia in dogs. I don't know of any that's are close to fruition at this point. Been worked on a lot. I think in our part of the world, it would be a nice thing to have. I know with other rickettsials like Lyme's disease, there's been a vaccine for dogs for Lyme's disease for years, and it has pretty good effectiveness. So apparently the Ehrlichia canis rickettsial organism is just different enough from the Lyme's organism that that technology doesn't really translate across. Vaccine would be wonderful if we could get one. It'd be a I think in our part of the world, especially in these guard dogs, it'd be a widely used product. Really, that's the long and the short of it. It's I would say endemic to our area. It's transmitted by ticks. It's treatable with tetracyclines, just like the other rickettsials. If you get to them, if you identify them early, you get to them early, I think you can do a pretty good job. If they're chronic, it's difficult to treat it. Just like if you hear people with Lyme's disease. Well, Lyme's disease is easy to treat if you get to it early, but once it gets into the chronic form and it's hiding in the bone marrow and the spleen, it's difficult to get it out of a person. You hear people that have chronic Lyme's disease for years and years. I think some of these dogs with chronic Ehrlichia, it's a similar situation. I think they have chronic Ehrlichiosis. Those animals, you just got to try to mitigate stress. You darn sure got to keep the ticks off of them. And be aware that that's what it is, and look for the clinical signs. They periodically need treatment, whether it's another course of tetracyclines or antibiotics. Tetracyclines or vitamins or anti-inflammatories. Really, that's Ehrlichia in dogs in a nutshell. You need back here?
Did you want to talk about that one?
Chagas? Well, I can tell you all I know about Chagas, which is not very much. Chagas disease it's not a tick-borne disease. It's transmitted by the kissing bug. It's not a rickettsial. It is a protozoa. It's more common deep South Texas, Mexico, Central America, South America. It's kind of difficult to diagnose, but the diagnostic lab in College Station now has a blood test for it. It causes heart disease. The protozoa, it enters the body. The kissing bug bites a dog or a person. The kissing bug creates a wound when it bites the person or dog, and then they defecate. And the feces from the kissing bug enters the wound that the kissing bug has created, and that's how it enters the body. The thing goes through the bloodstream and the tissues. It sets up. It has an affinity for the heart muscle, so it sets up in the cells that make up the heart muscle. And protozoa's jobs are to enter the cells and replicate. And as they do, they cause damage in the cells that make up the heart muscle. Well, you can imagine if the cells are being scarred up, the elasticity and contractility of the heart muscle is compromised, and the dogs and people typically succumb to heart failure. There's not a really good treatment. You treat the heart failure with symptomatic treatments, Lasix and medication to increase the contractility of the heart muscle. There's some people who advocate the use of an antifungal drug called itraconazole. I've seen regimens for using it. There's some other drugs in other countries that are not available in the United States that not familiar with, but I've seen in the literature. But it's a strange disease, and the best prevention is the kissing bugs. Avoid their environment. They like brush piles. They like dark, moist places, and it's typically south of here, South Texas, Mexico, along the border. But with people take a bird dog South Texas hunting and then go back to North Texas or Oklahoma, and you see areas where it's cropped up outside of the endemic area just from the mobility of the animals. They have a bunch of it in police working dogs and military working dogs that are trained down on the border, the Mexican border, and then go back upstate New York, and all of a sudden you got Chagas in upstate New York, but it's because the dogs moved from the endemic area back. But it's hard to diagnose. It's a strange disease, and sometimes the only clinical signs are death. The animals die of acute heart failure. And in my mind, it's poorly understood. I don't deal with it. We're out of the endemic area. I've never diagnosed it specifically in a dog. But again, with the mobile nature of these animals, like I said, mostly working dogs, hunting dogs that go to South Texas, go to endemic area, and then come back. That's where it's problematic. So.
Okay.
You need it. Yeah, what do we need?
Let's see here. Somebody was looking for that.
Dr. Womack, this is Reed. I have a question.
Yeah.
It's my experience that some of our ranchers get a little bit complacent about staying on top of the flea and tick control.
Right.
When is the brown dog tick most prevalent, and when would you recommend to really stay on top of your control throughout the year to try to prevent Ehrlichia?
Well, in our part of the world, it's out all year round, but obviously spring and summer's when it's worse. Especially if we've had much moisture, spring and summer are where we really got the most problems. Did you hear it?
Yeah, I got you. Thank you.
And
there was a question from somebody.
Yeah.
So you can just go ahead and address her right now.
Okay. Well, let me finish reading this. Okay. So do I have to? Can she hear me?
Yeah, she can hear.
Okay. I got the question about the Australian Terrier that got Ehrlichia while at a dog show. Wow. That's surprising. And in New York. So like I talked about earlier, can the doxy completely clear up the Ehrlichia? I think if it's real acute, I think we do get them. I do think we get them cleared. If it's chronic, can it recrudesce? Can it hide? I believe that it can. Think of it like people that have contracted malaria. They get it and get over it, and then something will stress their system out and it recurs. Yeah. I would think. So can it return without a tick bite? Again, I think if it became chronic and it colonized places like the bone marrow or the spleen, stress could certainly cause it to recrudesce. And then the second question about complicate reproductive systems. In the male, if it's to the point where they're having bleeding problems, absolutely. I think that ejaculation could cause bleeding into the accessory sex glands, maybe even the testicles. And obviously, if you get hemorrhaging in either of those systems, you're in trouble. The pregnant bitch, again, if Ehrlichia was lurking somewhere in her bone marrow or her spleen, and a stressor would allow it to recrudesce, pregnancy and parturition and lactation are tremendous stressors. So I would say that yes, Ehrlichia can definitely complicate reproduction. Absolutely, absolutely.
Thank you.
You're welcome. It may not be what you wanted to hear.
It's not that bad. I just
Right.
wanted to know the future options, or if it were to return. It never has returned, so.
Good. How long has it been?
Oh, a year and a half?
Okay, certainly been stress in the dog's life in a year and a half time span.
He even sired a litter of puppies, so I
Okay.
just wanted to know if I should expect it to return later on.
Yeah, I bet you licked it.
Okay, great, thank you.
You bet.
I guess I have a question. Can it be transmitted from the pup or the female to the pups? Or?
So Bill had a question of whether it could be transmitted transplacenally. I don't know specifically, but like for people, the rare instance that it transmits from a dog to a person, it's not from the dog's blood, it's from the tick. The tick has to bite them. So I would assume there's some type of life cycle completion that requires the tick. That's why not all tick species are capable of transmitting it. So I don't think that it could be transplacental. I don't know that for sure, but I do believe that it has to be to a tick's to complete its life cycle. Obviously, if the dam has ticks and the puppies are in close proximity, yeah, of course they can get it. Yeah, that's where a good vaccine would be real helpful. Vaccination would be helpful if we could get it. So, okay. Anybody else? Yeah, that's good.
Well, I don't see any other questions.
Well, everybody's well educated now and complacent in the disease transmission and control and treatment. So good. All right, you need back here?
Switch places. Well, if nobody else has any other questions for Dr. Womack, I guess we'll conclude our webinar today. Thank you again for Lone Star Tracking and Pfeiffer Ranch for sponsoring the webinar today. I'll also want to thank Dr. Redden for interim director here of the program, and Robert Fritz for helping us put on the webinar again, as always. Thank you guys very much for that support. And again, to the Sheep and Goat Predator Management Board for providing funding for this valuable program here at the AgriLife Center. So thank you guys very much for joining in today. And if you missed anything, or if you had friends that weren't able to make it today, it will be posted on our YouTube channel again. So thank you guys very much, and have a good day.